Judge, thank you very much, and to our friends at Christus Mother Frances Hospital, thanks for hosting us today. This has been a very helpful roundtable discussion for me, because while Congress has spent an awful lot of money to respond to COVID-19, the public health emergency and the economic fallout associated with it, one of the vulnerabilities that's been exposed is the lack of access to internet coverage, broadband generally. And nowhere is that a problem more than in rural parts of our country, and certainly that would help define East Texas, as we've heard here. And while the large internet companies are economically incentivized to build the infrastructure they need in populous areas, Dallas, Houston, San Antonio, Austin, and the like, they don't really have the financial incentives to do it in rural parts of the state. And that's why this access is so important, and why it takes all of us working together to figure out what the right solution is. Technology is changing all the time as well, and there are a number of options that are available, but it's been very clear to me that this is a real need. No longer is access to the internet a convenience. It really is a necessity these days. We saw that with our kids studying virtually online. We talked a little bit about the importance of telemedicine and the access to health care that this will provide for more folks living in rural parts of our state, including here in East Texas. So there were a couple of good things that we learned out of this terrible pandemic. And one of those important lessons is the importance of getting access to broadband. Again, no longer is this a convenience. This is really a necessity. So with that, I'm happy to answer or dodge a couple questions.
Senator Cornyn, I'm just curious, you heard from a variety of different people affected in different ways by limited broadband access. What stood out to you from today's roundtable?
Well, some of the maps that we've seen were pretty telling, because you know, while it's one thing to say rural areas don't have access, when you see it in color in some of these maps and charts, it's pretty, it jumps out at you. And one of the biggest problems we heard today is that there is some of this fiber available, but when you talk about the last mile, that's a frequent phrase being used here, where you actually get it from the backbone that exists to somebody's house or business. That's where the expense and where we need to focus our efforts, because again, it's not an economical proposition for the companies to build that out, and nor is it for individuals to have to pay that extra premium in order to get it to their home. So that's where the problem really lies. But again, this sort of reinforced my view that this is no longer a convenience, because people, you know, they do business over online. They do, you know, they learn online. Doctors provide access to health care online, both physical and mental health. So this is part of where we are now and why this is so important.
And Senator, earlier you mentioned it was great to see Smith County and Gregg County come together, but what is it like for you, now that we actually finished the roundtable, to have not just Smith and Gregg County, but also leaders from Deep East Texas as well? Does it make you want to work harder to be able to get these issues fixed for East Texas?
Well, most of the solutions that occur in America, and certainly in Texas today, occur at the local level. And we're blessed, in my experience, with great leadership at the local level, our cities, our counties, and those are folks who are closest to the constituents that they serve, and thus I think are more responsive to their needs. So part of what my job is, serving in the United States Senate and working in that forward operating base in hostile territory known as Washington, D.C., is to make sure we get the resources freed up to help our local leadership provide what is needed. One of the points that was made earlier is the diversity of our state. And we've got big populous cities, some of the biggest cities in the country, but we also have rural areas, and we need to make sure that people's needs in these rural parts of the state are attended to. And that's the reason I'm here today, and glad to see the progress that's been made, but also what else we need to do.
Senator, we're seeing a lot of increased competition nowadays with companies trying to install these fiber networks and trying to get broadband and everything to the people. Who would you say benefits the most from that, and would you say there's anyone that's left out as a result?
Well, it sounds like a good reason to have a plan, and what I've heard from some of these leaders is that there are plans and a lot of study and work being done into it, because there's not, we don't, when you don't have access to broadband, we don't need a lot of duplication and overlap or inefficiency when it comes to spending the money. We need to use the money wisely. These are tax dollars, and to make sure that they are actually solve the problem. So to me, that was one of the encouraging things I heard here today, is some of the hard work and planning that's already taken place, and that brings us that much closer to actually seeing this implemented, as opposed to just being an idea.
All right, last question.
Senator, at the end of today's roundtable, you compared this to bringing electricity to rural areas, something that was done a long time ago. Do you feel that that really is kind of the size of the task that is at hand here?
Yeah, I mean, when you confront a new problem, frequently I think it's helpful to think back, okay, what's an analogous or similar situation? How do we address that? And to me, rural electrification, which is something that's sort of in our dim memory of the past, but back, it wasn't that long ago, in the 1950s, that era where people didn't have access to electricity. And this is just another electronic connection, but now with broadband. So to me, that's a useful way to think about it, but we overcame that deficit and that lack of connectivity back then, and we can do this now. Thank you all very much.